Maria. This morning on today's Health, decade by decade health checks for women as we approach a new year. Always a good time for women to make health checkups and screenings a top priority. And here to help us, Dr. Keri Peterson. She's an internist and contributor to Women's Health magazine. Dr. Peterson, good morning.
Good morning.
So women, we tend to be the caregivers. We tend to neglect our own health, but it's time to take charge. Why is it so important for us to really make sure that we're getting these checkups annually?
Well, each decade more diseases are prevalent as we age, and it's just really important to detect them early so that we can either stop them altogether or prevent any complications from them. And you mentioned that women tend to forget to take care of themselves, but studies have shown that when women take care of themselves, the health of their family improves as well.
So there you go. There's reason number one to make sure you do it. Okay, so let's start off with our 20s. And what kinds of things should we already be thinking about? Because prevention really is the key here.
It is. The first thing to consider is examining your moles. Once a month, just do a thorough skin exam to look for any changes in the size, shape, or color of your moles. And then once a year, have your doctor check that as well.
Okay, careful for skin cancer. Pap smears as well. At what age do we start getting those?
Pap smears are necessary to screen for cervical cancer, and you should start getting those at age 21 or 3 years after you've become sexually active, whichever comes first. And in your 20s, you need to do them every single year.
Okay, and then also cholesterol and blood pressure, we'll group those together because usually they're done together.
Both of those should be checked starting in your 20s. Your cholesterol, you should find out all three parameters, the bad, the good, and the triglycerides, LDL, HDL, triglycerides, and check that every 5 years. And for your blood pressure, you really in your 20s want to start getting that checked every 2 years, and it should be below 135 over 85.
Okay, and then moving on into the 30s, a lot of those same tests you're going to be continuing to do from your 20s on, but some new ones as well. You say you should start to get your thyroid checked out. Why is that so important?
In your 30s is when thyroid disease starts to become prevalent. You'll notice that you may have some fatigue, some weight gain, so that should be checked every 3 years, starting at about age 35.
Okay, and then you also added the tetanus vaccine. I think a lot of us forget to do that,
We do. It's a good reminder in your 30s to think about it. Many people will get it when they entered college in their late teens, and you may not think about it in your 20s, but in your 30s, you should get one every 10 years.
I know, or when you slice your finger like I did once, and you have to get the tetanus booster again.
Don't wait till last minute.
And then after you turn 40, another group of tests. We're going to start off with the mammograms. Now, of course, this is somewhat controversial. You know, over the past couple of years, there's been some mixed advice on this.
There has been, but the consensus still is begin at age 40 and do it every 1 to 2 years in your 40s, and then once you're in your 50s, do it annually.
So once every 2 years.
1 to 2 years.
1 to 2 years.
You can talk about that with your doctor.
And then diabetes screenings as well.
That's correct. Start that at about age 45, especially if you have a family history, and that should be done every 3 years as well.
Okay, good time to get your eyes checked.
It is, not just for vision, but also for screening for glaucoma, and that may present with no symptoms, but it is a leading cause of blindness. So in your 40s, go to your eye doctor every 2 years.
I think your eyes may remind you of that at 40 anyway, because that's when you start needing that. Is that right? Okay, and then also a good thing to do is get a fecal occult blood exam. Now, what does that mean? This is not a colonoscopy.
It's not a colonoscopy. It is the initial screening test for colon cancer. It's when your doctor does a digital rectal exam to check the stool for microscopic blood, and it will screen for colon cancer.
Okay, so next, moving on to the 50s, and this is when we do start thinking about colonoscopies or colon cancer, specifically these screenings.
That's right. In your 50s, you should start getting your colonoscopy once every 10 years. Unless you have a family history, then you may need it earlier, and you should check with your doctor about that.
Okay, and a hearing test, right?
A hearing test, yes. Once you're in your 50s, about 1 in 6 people start to develop some degree of hearing loss, especially with those high-pitched sounds. So you may notice you're saying, what, in a restaurant? So get it checked out every 3 years.
Okay, and then moving on to our 60s, and body's going through a lot of hormonal changes in this decade, right, from 60s and beyond. So what are some things that you should be thinking about here?
That's right. Typically, women have reached menopause at this point, so you should start thinking about osteoporosis screening. Really, you don't need to start getting checked until you're 65 unless you have risk factors. And there's many, many risk factors, but to name a few, if you have a family history of osteoporosis, if you drink excessive alcohol, or if you hit menopause very early, that puts you at an earlier risk of developing the disease.
Okay, now the influenza vaccine, you should be getting these yearly, right?
Once you're in your 60s, your immune system starts to weaken, and you're more susceptible to getting several diseases that you require vaccines for. one of which is certainly the influenza vaccine. You should be getting that every year, especially in your 60s. But in addition, now you also need the pneumococcal vaccine, which is given 2 shots 5 years apart. And also consider getting your shingles vaccine just to prevent the severity of the disease, because once you're in your 60s, there's a much greater chance of getting it.
All right. Well, Dr. Keri Peterson, a lot to get through.
Yes.
Thanks so much. You
Thanks,
did
Natalie.
it, and I got a lot of checkups that I've got to schedule.